As a neurologist, you divide the nervous system into the central nervous system, by which I mean the brain and the spinal cord. And the peripheral nervous system are the nerves which come out from the spinal cord. They become nerve roots. Then they form a collection of nerves in the armpit or the pelvis called the plexi. And then they come out into the arms and legs. And what you have in the peripheral nerve are nerves which supply sensation, but also motor function by which it enables you to move your arms and legs. And peripheral nerve disorders, in a broad sense, are diseases or processes which affect the nerve roots, the collection of nerves, the plexuses, or the nerves which are in the hands and feet. And that is the label we give to the disorders affecting this anatomical area of the nervous system. The number of causes of neuropathy are as long as my arm. If you look at the textbooks, there'll be 2 big volumes that cause neuropathy. But in a very broad sense, the commonest cause of neuropathy in the world is diabetes or prediabetes. And in some parts of the world, the other common cause is, in fact, HIV infection. But then the other causes that one always has to think about are inflammation of nerves, because that is potentially a very treatable cause of peripheral neuropathy. You can have neuropathy if there's an underlying cancer in the body, what we call paraneoplastic. Drugs, medications, very important cause of neuropathy. And as a neurologist, you have to be up to date about all the new drugs, what causes neuropathy, because otherwise you may miss the diagnosis. People can have neuropathy because of lack of vitamins. So vegetarians, for example, are very predisposed to having neuropathy due to vitamin B12 deficiency. People drink too much alcohol and don't eat good food. Thiamine deficiency gives you a painful neuropathy. You can also get neuropathy due to mechanical causes. So for example, if you have a nerve in your wrist which is being trapped, carpal tunnel, that'll give you a neuropathy affecting one particular nerve. As I've said, infections, HIV, worldwide, especially in tropical countries, leprosy is an important cause of neuropathy, which is very treatable. You also get neuropathies due to genetic conditions. So there are genes which are passed down in the families. The common is called Charcot-Marie-Tooth. But perhaps importantly, and what's changed in my career span, is that we have a genetic neuropathy now, which is treatable due to amyloid TTR neuropathy, which is unheard of. When I qualified, you wouldn't dream that you could treat a genetic neuropathy, but now you can. So those are the sort of main causes that when I see patients that are going through your mind, trying to work out what the diagnosis is. There's a list that you're just going through to sift through and try and work out what the answer is. Sensory nerves are the ones which transmit sensation from the hands and feet to the brain. And if they're damaged, what people experience is either numbness, which is a lack of sensation. But interestingly, you can also get pins and needles, or you get pain, or you get what's called allodynia. So somebody touches the hands, causes pain, which is very abnormal, because when damaged nerves fire away electrically, they cause these painful symptoms. So numbness and pain and pins and needles, and sometimes it comes all together. Because the motor nerves can be affected, you can get weakness. So people, for example, may have foot drop, so that when they walk, they trip. You can have weakness in the hands, so you can't open bottle tops, or you can't use a computer pad properly. Opening the key in the door is difficult. So you get weakness, but also you get these sensory symptoms together or sometimes separately. Those are the main symptoms that people will be presenting with to me. A very important example where this can happen very acutely, and people need to know about this, is called Guillain-Barré syndrome, where they get paralysis very quickly within hours or days, and it's a medical emergency. It's triggered off by infections generally, including now COVID. So those are the symptoms that you get with peripheral neuropathy, and very acutely you need to worry about this condition called Guillain-Barré syndrome. Again, very treatable. So the treatment really depends on the diagnosis. And apart from the history and examination, we use electrical tests to diagnose peripheral neuropathy. We use a range of blood tests. We may end up doing a lumbar puncture test. And in about 30% where we have no answers from those tests, we do a nerve biopsy or a skin biopsy. And really the treatable causes are inflammation, which we can treat with steroids or intravenous immunoglobulin. If you have vitamin deficiencies, or if you have an infection. So the bottom line is that you treat the underlying cause, and then with time, you can expect some degree of regeneration to come through. Our treatments do not cause regeneration of nerves. You have to stop the process damaging the nerves and give time before you get regeneration of nerves. So if it's diabetes, you must control the diabetes as tightly as possible, as an example. So like in medicine generally, the earlier you make a diagnosis of neuropathy, as you would make of, for example, cancer, then the chances of early treatment stopping the process causing the damage is better, and you get more chance of recovery. But there are certain conditions where once the damage is done, you're left with that fixed damage and you can't repair it yet. But I think with time, we will have new treatments for nerve regeneration, but that's all in the future.